This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Pediatric Cardiology Fellowship Program is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
I can't imagine a better job in the world than being a pediatrician. We are here for four things. We're here for clinical care for sure, but we're also here for research, we are here for education, and we are certainly here for advocacy. And fellows that come that are excited about that four-legged stool that really supports all of pediatrics, we're going to be excited about them.
The learning environment here and the camaraderie within the Department of Pediatrics is why I chose OHSU in the first place. And then I stayed here for a chief year and then fellowship because of the people and this department that really works together and supports each other.
The camaraderie is fantastic within all the different departments, and the faculty really make us stay in charge and have the ownership of our patients. And my preceptor is there to supervise. I, as an oncologist, feel proud and comfortable having these discussions, and that's primarily due to the freedom that is being given to our fellows.
I have mentors from all different parts of the department and across the institution as well. Dana Brainer is an amazing cheerleader for our whole department. In the last few months, he's been sending out these emails during times of COVID that sort of elevate and work to unite us against this force and reminding us what our mission is, which is to take the best care out of our patients and families here at Dornbecker.
We are very big on communicating and we're very big on transparency. Nothing will happen to our faculty or our trainees or the nurses or the therapists or the dietitians or the 2,000 people who work here to support children without them knowing about it and without them being a part of it. And I love the fact that the fellows push me to be a better physician in literally every interaction I have with them. One of the benefits of being in a smaller program is that you really do get to know everybody here, and they in turn get to know you. And so when I'm on the phone with prospective jobs for these fellows, I'm able to speak in a way that a lot of fellowship directors or a lot of chairs at other larger programs really can't.
Most fellowship programs, have a very set curriculum in how a program is developed. So it really comes down to the people and the opportunities, and it's very, very important for the applicants to really know the people that they'll be working with.
What I would say is different about OHSU is that it will value whatever you want to value as well. It doesn't have to feel like fellowship is one more stepping stone where then you might go forward and do something different. You can start doing that different thing now.
We have created a community of people here who are very much for children and families, but also are incredibly able to get the work done, to learn from each other, and to have a good time doing it. And even though it's a cliche that, we say our faculty is like a family, our faculty is very much like a family. And I think that really helps. And when our fellows emerge from this program, they will be able to go anywhere in the world and do amazing things. And that's what we're all about.
Pediatric cardiology, I think, is special. You develop a relationship with the family under very high acuity, intense circumstances. And then you continue that relationship, and the combination of the high intensity and then this bond that you've created is really unique to our field and really gratifying. We hope to find an applicant who wants to work in a medium-sized program with faculty who love to teach, who love to mentor, and an environment in which the fellow is the center of the patient care experience. I trained in a very high volume fellowship program. When I came to Oregon, I recognized right away that the advantage of a lower volume program is that you spend more time with every patient. You can have deeper discussions with the faculty and with each other about each lesion, and you can spend some time reading and thinking about them. I think getting more out of each patient experience. How are we setting this child up for their life in terms of their neurodevelopment, the other organ systems? What sort of quality of life will the child have? And that's a big part of our field now.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. This is OHSU.